If you're watching this right now, there's a good chance you've felt it. That tingling in your fingers, that numbness creeping up your leg. Maybe it happens when you're trying to sleep, or it wakes you up at 3 in the morning. You shake your hand, rub your leg, and it goes away for a while. But then it comes back. Listen closely, because what I'm about to share with you could genuinely change how you experience that sensation, and more importantly, what's actually happening inside your body when it occurs. My name is Dr. Anderson, and I've spent the better part of 20 years watching patients dismiss nerve pain as just part of getting older. It's not. And that's the critical mistake we need to address today. Nerve pain and tingling aren't random. They're your body's emergency broadcast system. Think of your nerves like electrical wiring running through your house. When that wiring gets compressed, pinched, or starved of blood flow, the lights start flickering. The message gets garbled. Now here's what most people don't realize. If you ignore that flicker long enough, the bulb doesn't just dim, it burns out. Chronic nerve pain is one of the most underestimated health threats facing adults today, particularly those over 50. We're not talking about a minor inconvenience. Untreated neuropathy, that's the clinical term for nerve dysfunction, can lead to permanent nerve damage, loss of sensation, difficulty walking, and a dramatically reduced quality of life. I've seen patients in my practice who waited too long, and by the time they came to me, the damage was already irreversible. The tragedy is this: most of these cases were preventable. Let me break down what's actually happening in your body when you feel that tingling or numbness. Your peripheral nerves, the ones running from your spine out to your limbs, depend on two critical things: blood flow and space. When either of those is compromised, your nerves can't function properly. The most common culprit? Compression. A tight muscle, inflamed tissue, or even postural stress can squeeze a nerve like a garden hose getting kinked. When that happens, the nerve's ability to transmit signals gets interrupted. You feel that as tingling, numbness, burning, or that characteristic pins and needles sensation. But there's another mechanism at work: inflammation. When tissues around those nerves swell due to injury, repetitive stress, or metabolic dysfunction, blood flow decreases. And nerves without adequate blood flow, they starve. They start misfiring. And over time, that damage accumulates. The reason this matters is that your body has an incredible capacity for healing, but only if you give it the right conditions. Here's what I want you to try, and I want you to do it with intention. The 1-minute vibration technique works because it leverages something called mechanical stimulation to accomplish several things simultaneously. When you apply gentle rhythmic vibration to the affected area, you're doing 3 critical things. First, you're increasing localized blood flow. Vibration activates muscle fibers and causes microcontractions. Those contractions pump blood into the area, delivering oxygen and nutrients that nerves desperately need. Second, you're interrupting the pain signal itself. This is based on something called the Sundao gate control theory of pain. Essentially, your nervous system can only process so many signals at once. By flooding that area with the sensation of vibration, you're literally closing the gate on pain signals trying to get through to your brain. Third, you're gently mobilizing any compressed or irritated tissue. That tightness that's been pinching your nerve, vibration helps release it. Now here's the critical part. This works best when you combine it with other interventions. That's the synergy I mentioned. I want you to try this today, and I want you to be consistent. Step 1. Locate the area where you're feeling tingling or numbness. If it's in your hand or fingers, we'll focus there. If it's your leg or foot, same principle applies. Step 2. Use a tool. This could be a personal massager, and yes, they make ones specifically for this, or even your phone on vibrate. Some patients use a simple handheld vibrating device from a hardware store. The frequency should be gentle. We're not trying to shake your entire arm off. Step 3. Apply the vibration directly to the affected area for 60 seconds. Not more, not less. 1 minute of consistent, gentle vibration. Step 4. Pay attention to how you feel. Most people notice a change within the first few applications. The numbness might lift slightly. The tingling might become less intense. That's your nervous system responding to improved blood flow. Step 5. Repeat this 3 to 4 times daily. I recommend once in the morning, once in the afternoon, and once before bed. Consistency matters more than intensity. The why factor, what most doctors won't tell you. Now, I'm going to be honest with you about something. If you go to a conventional doctor with tingling and nerve pain, you'll likely get one of 2 responses: an anti-inflammatory medication or a referral to a neurologist for expensive testing. And look, those have their place. But what you often won't hear is this: many cases of peripheral nerve pain respond beautifully to mechanical and circulatory interventions, before you ever need pharmaceuticals. That's not because doctors are trying to hide something from you. It's because the medical model I was trained in emphasizes diagnosis and medication. We're less practiced in teaching patients how to use their own body's healing mechanisms. The vibration technique is old world wisdom meeting modern understanding of neurology. Athletes have used vibration therapy for years. Physical therapists recommend it, but it hasn't made it into most people's home health toolkit, and that's a missed opportunity. Additionally, this approach works synergistically with other interventions. Combine the vibration technique with improved posture, with stretching, with adequate hydration and nutrition, and you're not just treating the symptom, you're addressing the root cause. Here's what I want from you right now. I want you to comment below and tell me, where are you feeling this tingling? Is it in your hands? Your feet? Does it wake you up at night? Because the more I understand about what you're experiencing, the better I can tailor future content to help you. And if you try this vibration technique, come back and let me know what happens. Did it help? How long did the relief last? Your feedback helps me understand what's actually working for real people dealing with this issue. The serious, encouraging wrap-up. Let me leave you with this, and I want you to really hear it. Nerve pain is not a life sentence. It's not something you have to accept as the inevitable cost of aging. Your nervous system is remarkably resilient. It wants to heal, but it needs the right conditions, and it needs consistent attention. That 60-second vibration trick? It's simple. It costs almost nothing. And for many of you, it's going to be a game changer. Not because it's magic, it's not, but because it's addressing the actual problem: blood flow, compression, and nervous system function. The time to address this is now. Not when the numbness spreads, not when you lose sensation in your feet and can't walk safely, not when the damage is permanent. You have the power to intervene. Use it. I'm Dr. Anderson, and I'll see you in the next video.